Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be looking at the plasminogen activators. So plasminogen activators, they are the classification of the fibrinolytics. See, plasminogen activators, that is a classification of the fibrinolytics. So the first one here is the fibrin non-specific plasminogen activators. So there is a fibrin non-specific. So we have a fibrin non-specific plasminogen activators. So under this fibrin non-specific plasminogen activators, the first one being the streptokinase. So let's look at the streptokinase. So this streptokinase is the least fibrin specific and has the lowest incidence of the intracranial hemorrhage. So it has the least fibrin specific. And it has the lowest incidence of the intracranial hemorrhage. So lowest incidence of the intracranial hemorrhage. Next is another drug under the fibrin non-specific plasminogen activators. It includes the anistreptase. Anistreptase. Next is also the urokinase. The next one is the fibrin specific plasminogen activators. So far we have seen the non-specific. So let's look at the fibrin specific plasminogen activators. So under the fibrin specific plasminogen activators, first one is the altiplase. So under the altiplase, it has the shortest half-life. So there is the shortest half-life is the altiplase. Second, we move on to the tenecteplase. So under the tenecteplase, the most fibrin specific and given as a single bolus dose. So altiplase is the shortest half-life. Next is tenecteplase is the most fibrin specific. It is the most fibrin specific and given as a single bolus dose. So it is given as a single bolus dose. Next is another drug is the retiplase. Next we have the retiplase. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.